Now, in endocrine physiology, the gland we are going to concentrate much on is none other but our so-called thyroid gland and its endocrine functions. Physiology. Thyroid gland. Why we are much interested? Because thyroid gland is capable of producing two important group of hormones. The first major group of thyroid hormones exclusively responsible for maintaining basal metabolic rate, thyroid hormones T3 and T4. On the other hand, it is also the same thyroid gland which is also known for one other important hormone totally concerned with calcium regulation. We are going to see soon, calcitonin. Only for this two important group of hormones, our thyroid gland is very important. Why this segregation is important in the beginning itself? Because in thyroid gland, the cell which is going to produce my thyroid hormones are called as, always remember, this fact itself is an MCQ, follicular cells. On the other hand, is the same follicular cells produce calcitonin? Definitely no. Calcitonin comes from a cell that is near your follicular cell. Anything which is near, we always use the word para. It is near to my follicular cell. That's our parafollicular. They produce calcitonin that starts with the C. That's why they are called as calcitonin producing C cells, parafollicular C cells. So thyroid hormones comes from follicular cells, calcitonin comes from parafollicular cells. From this fact, let's move on to concepts. The first cell we are going to take is none other but follicular cells. A schematic representation of a typical follicular cell, kindly make a note, is in front of us now. Suppose if you want to form thyroid hormones, kindly make a note, you require two important ingredients. What are they? The first important ingredient must come from our diet, which is a mineral. What is that mineral? That mineral is none other but iodine. On the other hand, to form our thyroid hormone, one other important amino acid is required. As I told you, thyroid hormones, amino acid derivatives. What is that important amino acid? None other but tyrosine. This tyrosine is usually available in thyroid gland in a big molecule form. That molecule is none other but a globulin, thyroglobulin. That's all. The source for this iodine is diet. The source for these tyrosine molecules are a big globulin molecule, thyroglobulin. That's all. If you understand this point, kindly make a note, this iodine must come from our diet. A recent community medicine, PSM MCQ. What is the dietary absorbable form of iodine? It is not the oxidized form, it is always absorbed in the reduced form iodine. The dietary absorbable form is always the reduced form, none other but iodide, which we always write this as I minus, reduced form. It has got a huge significance. That's why I am telling you in the beginning. From our diet, the absorbable form of iodine is the reduced form iodide. Now, any part of a cell, you can clearly see here, if it comes near a blood vessel. Always remember, any part of a cell, if it comes near a blood vessel, we call that end as basolateral end. The exactly end that is opposite to this basolateral end is apical end. There are two ends to a follicular cell, basolateral end present near a blood vessel. The opposite end is apical end. Why this segregation is important? There are a lot of channel proteins which can be present either in basolateral side or in apical side. Now look in the screen. From our diet, iodine is absorbed in the reduced iodide form. You are going to send this reduced iodide form in the blood. From GIT, the iodide now reaches blood. If this blood comes near our follicular cell, to take this iodide inside, my thyroid gland in the basolateral side has got an important channel protein. It not only transports iodide inside, it also transports every time one sodium ion inside. Sodium, iodide, both are transported together. This channel protein is present in basolateral end. What is the name given to this transport protein? Very important MCQ. also recently asked in AIMS exam, look in the screen, that important channel protein is called as sodium iodide. Both are transported together. That's why we call this important transport protein as sodium iodide importer. It is always written as Na for sodium, I for iodide. Sodium iodide importer. First MCQ, where will you see this? It is present only in the basolateral side. What type of transport process is this? Iodide transport requires sodium. That is why we call this important transport process as, never forget, secondary active transport process. It requires energy, that's why it is active. Sodium is required for transport of iodide, that's why it becomes secondary active transport process. Where will you see this important channel protein? This channel protein is present in thyroid gland. Not only thyroid gland, it was also shown to be present in one important salivary gland. That salivary gland is parotid gland, expresses sodium iodide importer. It is also present in, kindly make a note, mammary gland. Kindly make a note, it is also present in mammary gland. And one last important recently discovered location, placenta. Sodium iodide importer mainly present in 4 locations: thyroid gland, salivary gland, parotid gland, mammary gland and placenta. All these 4 organs can actually take up iodide. They can take up iodide because they all have our sodium iodide importer. Very important MCQ. Where it is present? It is present in basolateral side. Which form of iodine does it transport? It always transport the reduced form iodine. Now let's see where the channel protein is located. Let's go back to the previous picture. Our channel protein is here, sodium iodide importer. It transports iodide inside. Look in the screen now. To all our surprise, whenever iodide comes inside, it is quickly pumped out of the cell from the other end. It is quickly pumped out of the cell from the other end. Then why it have to take inside? Why it is quickly pumping outside? Kindly make a note, that most important MCQ. What is this form I told you? This form is none other but reduced iodine. But for hormone synthesis, what is required is always oxidized iodine. Most important concept. Even though the absorbable form is reduced iodide, but for all thyroid hormone synthesis, the form responsible is oxidized iodine. Most important MCQ. Look in the screen now. Even though I am simply drawing iodide moving out, it does not happen just like that. Whenever if you throw out a negatively charged ion outside, to balance that, kindly make a note, one important ion have to be shifted inside. To maintain neutrality, throwing out one negative charge have to be balanced by throwing inside one negative charge, that is always chloride. You can clearly see in the apical side of a cell, there is one transport protein which transports iodide outside. To maintain neutrality, it transports chloride inside. How are we going to name this transport protein? Look in the screen. The name given to this transport protein is none other but, kindly make a note, iodide is transported, chloride is transported. Both are transported in opposite direction. That's why it becomes antipode. Not in same direction. Same direction means sympode. Opposite direction, antipode. The first important MCQ, where are you seeing this channel protein? Apical side of which important cell? My follicular cell. Not in basolateral, apical side. The second important MCQ, please look in the screen. Very important MCQ, look in the screen. It is present in thyroid gland, very good. Not only thyroid gland, it is also present in human inner ear. Suppose such a critical protein, if it undergoes mutation, definitely thyroid gland will be affected. In this mutation, the patient is definitely going to have enlarged thyroid gland, goiter. If the channel protein is mutated in inner ear, the patient will definitely have sensory neural hearing loss. Definitely would have understood now. This iodide chloride antipode mutation causes goiter with sensory neural hearing loss. It is commonly seen in one important syndrome. What is that syndrome? That syndrome is our so-called Pendred syndrome. Very important MCQ. Now let me tell you the physiology. The other name for this iodide chloride antipode is our so-called pendrin protein. Most important MCQ. The other name for this channel protein is pendrin protein. Pendrin is also called iodide chloride antipode. Present in thyroid gland, pendrin mutation causes goiter. Present in inner ear, pendrin mutation causes sensorineural hearing loss. That is why we call this important syndrome as Pendred syndrome. Pendrin protein. Where is that actual pendrin protein, sir? It was I shown before. It is this channel protein which is our so-called pendrin protein. Very important MCQ. Iodide chloride antipode. Now come back to physiology. For hormone synthesis, oxidized iodine is required. This reduced iodide is pumped out. Why? For the most important reason, conversion of reduced form to oxidized form is always done by one important enzyme whose name is TPO. What does TPO stands for? TPO is none other but our so-called thyroperoxidase or thyroid peroxidase enzyme. This enzyme is present only in the cell membrane of this follicular cell. It is for this reason, kindly make a note, iodide is pumped outside. With the help of this membrane bound enzyme, thyroid peroxidase, reduced iodide is converted to oxidized iodine. Only this oxidized iodine is going to form hormones now. Kindly make a note, once you have oxidized iodine, the next important precursor, kindly make a note where the source for your tyrosine is thyroglobulin. Once the oxidized iodine is available, once the thyroglobulin is available, combine both of them. What's the name of this combining step? This combining step is always called as coupling. Combining iodine with thyroglobulin is called as coupling reaction. The most important MCQ, kindly make a note. When one molecule of iodine combines with one molecule of tyrosine, the most important form we are going to get is called as monoiodotyrosine. Very important MCQ. This monoiodotyrosine is called as MIT. First product to form. If you combine two molecules of MIT, the next important form we are going to get is called as diiodotyrosine. 1 plus 1 is 2. This form is called as diiodotyrosine. Second form. We know there is monoiodotyrosine. We know there is diiodotyrosine. Combining one molecule of monoiodotyrosine plus one molecule of diiodotyrosine, the product now we are going to get is the most important hormone, T3 hormone. MIT combines with DIT always gives T3 hormone. This T3 hormone is considered to be always the active hormone. This hormone is always considered to be the most potent hormone. That's all simple. If you combine two molecules of DIT, please to make a note, if you combine two molecules of DIT, the form you are going to get is T4 hormone. That's all. MIT combined with DIT gives T3. Two molecules of DIT combine to form T4. All these are normal physiological products. 4 products. What are they? MIT, DIT, T3, T4. Look in the screen. By any chance, recent AIIMS exam MCQ. If you combine one molecule of DIT plus a molecule of MIT, if DIT first combines with MIT, does this looks exactly like the reverse of this process? It looks like the reverse of this process. If DIT combines with MIT, you will not get T3 hormone. The form we are going to get is called as RT3. What does R here stands for? R is our none other but so-called reverse T3 hormone. Recent AIIMS exam MCQ. Kindly make a note. If DIT combines with MIT, you will get reverse T3. To form the normal hormone, MIT must combine with DIT. If the reaction is reversed, you will get reverse T3. This reverse T3 is considered to be a very highly inactive form. Body produces reverse T3 more exclusively during only one state. Recent AIMS exam MCQ, any individual who is undergoing starvation, that most important state where body predominantly produces more inactive form of thyroid hormone, reverse T3 is starvation. Reverse T3 more during starvation. During normal states, it is always the normal T3. To form reverse T3, you combine DIT first with MIT, that's all. If you understand this entire sequence, we formed thyroid hormones now. Look in the screen. That most important MCQ. Once you form thyroid hormone, ultimately after this formation, all the thyroid hormone is going to store inside my follicular cell. If you look under the microscope, always a thyroglobulin will be seen in the center. In one periphery, there will be a monoiodothyrosin. In other periphery, you will get a diiodothyrosin. In this extreme, you will get T3 hormone, most important. In this end, you will get T4 hormone. All these are collectively stored inside your follicular cell. The name given to this storage form is none other but our so-called colloid. Kindly make a note. What is this colloid? Colloid is none other but the storage form, storage form, storage form. The storage form of thyroid hormone is usually called as colloid. This was a recent NEET PG MCQ. If your thyroid gland is inactive, if it is not producing any new hormone, this colloid storage form itself is sufficient for survival up to 2 to 3 months. Remember, not days, not weeks, it is for months. We have reserve storage hormone of thyroid hormones for survival. If your thyroid gland is not performing its function, the storage form itself sufficient for survival up to 2 to 3 months. We have that much of storage reserve hormone in your thyroid gland. The storage form is called as colloid. Whenever you need thyroid hormone, the only thing you have to do is kindly make a note, you have to break down this colloid. If you break down this colloid, you will get free hormones. Obviously, after broken down, we are going to release this free hormones into bloodstream. That's all. Very important MCQ. If you want to have thyroid hormone, break down this colloid form. Thyroid hormone automatically comes out. This free hormones T3 and T4 are now liberated into blood vessel. That's all. What will happen to this thyroid hormones inside this blood vessel? Very important MCQ. Let's see now. Please look here. For all our understanding, I am going to magnify that same blood vessel which we saw before. For our understanding, this blood vessel is magnified now. What we did? We released thyroid hormone into this blood vessel. After release, kindly make a note, only 1% of this hormones remains free. What happened to the remaining 99% of T3 and T4, sir? They were quickly bounded by certain proteins which are called as binding proteins. Immediately after release, only 1% of hormones remains free. Remaining 99% is quickly going to be bounded by certain proteins which are called as binding proteins. Look in the exam. This binding proteins was recent DNB June 2018 MCQ. What are the binding proteins for thyroid hormones, sir? They are 3 important binding proteins for thyroid hormone. The first important binding protein for thyroid hormone is none other but my so-called albumin, plasma protein. Albumin can bind thyroid hormone. The next important binding protein is going to be a globulin. What is this globulin called as, sir? TBG. What does TBG stands for? Thyroid hormone binding globulin. That's all. Very important. TBG stands for thyroid hormones binding globulin. Only one loss form, recently discovered form. This form is called as transthyretin. Kindly make a note. This form is called as transthyretin. There are 3 binding proteins: albumin, thyroid binding globulin, transthyretin. MCQ. Out of this 3 forms, which one is always considered to be the major form? Thyroid binding globulin. Why major? 70% of hormone binding happens only in thyroid binding globulin. Only the remaining 20% goes to albumin for binding, and the least important last 10% goes to transthyretin. The most important binding form is always thyroid binding globulin. Next MCQ. This transthyretin is also called by one other name. That form is called as prealbumin. The other name for transthyretin is prealbumin. Recent MCQ. Transthyretin or prealbumin both mean one and the same. I have strategically written this transthyretin, highlighting Thi. That means it can transport thyroid hormones. Not only that, it also has got the red part. That means red here stands for vitamin A. It is also the transport protein for vitamin A. Transthyretin transport two important substances. One is thyroid hormones. Next is vitamin A. Very important things. Three binding proteins: albumin, globulin, transthyretin. Major one is always thyroid binding globulin. Simple. If you understand this thing, in thyroid physiology, now we know how the hormones are synthesized. Now we know what are the binding proteins for thyroid hormone. With this important concept, kindly make a note. There are two major hormones coming from thyroid gland. You must be able to clearly differentiate these two important hormones. Which one is the most active form? T3 form. Which one is always considered to be less active form? T4 form. Which one is always considered to be the most potent form? T3 form. Which one is always considered to be the less potent form? It is always T4 form. When they ask you which has got the most rapid action, shortest T-half, it is T3 form. Which always has got the longest half-life? T4 form. That's all. Kindly make a note. T3 is most active, most potent, short T-half. T4 is less active, less potent, long T-half. All the actions of thyroid hormones in physiology are always due to T3 hormone. That is why physiological is always T3 form. On the other hand, you can clearly see T4 seems inferior, less active, less potent, long T-half. Because of this important aspect, long T-half, remember T4 is always the preferred drug form of thyroid hormone. Kindly make a note. Drug form is always T4. Long T-half. Always remember that collective MCQ point is T4 is always pharmacological, T3 is always physiological. That's all. Very important MCQ. If they ask you, even though we consider T3 form is most active, most potent, it is always the active form which is less in blood circulation. It is always the less active form T4 more in blood circulation. All these are important concepts. The active form is less in blood, but the inactive form T4 is always more in circulation. Remember only one point. T3 is physiological, T4 is pharmacological drug form. That's all. If you understand this thing, from these things ultimately where are we now moving on into thyroid hormones? All these aspects of thyroid hormones, why are we discussing? Ultimately for this important area, you need to remember the actions or physiological functions of thyroid hormone. Whenever I say thyroid hormone, the function is solely performed only by T3, not reverse T3, not T4. It is only T3, that's a physiological form. Again reinstating the same point, actions of thyroid hormone. Think by yourself, why nature preserved something called as thyroid hormone? It is capable of performing certain functions which are not done by other hormones. What are these important functions? The first important function of thyroid hormone, where it is exclusively known for, till now we have used more than 100 times this important word, which is none other but BMR. What does BMR stands for? B for basal, M stands for metabolic, R stands for rate. Just pause for a moment and think by yourself, what is this basal metabolic rate? What's the function of thyroid hormones on this basal metabolic rate? Very simple concept, guys. In this entire words, I am just only highlighting metabolic. It means it stands for metabolism. It stands for the metabolism of human body at rest. That's all. Basal metabolic rate means metabolism happening in human body at rest. That's all. This basal metabolic rate is increased by my thyroid hormone, which means thyroid hormone increases metabolism at rest. Correct, Dane? It increases metabolism at rest. What is the meaning of metabolism, sir? Even further dissecting the word, metabolism invariably means in cells oxygen consumption. If it is consuming oxygen, it means it is undergoing metabolism. That's all simple meaning. Thyroid hormone is going to increase oxygen consumption. By this function of basal metabolic rate, what we mean? Thyroid hormone increases metabolism at rest. It increases oxygen consumption in virtually all the cells of human body. Very important MCQ. It is known for basal metabolic rate, increasing oxygen consumption at rest. First function. The same thyroid hormone other than this is known for what other important function? T3. Where will you come across in biochemistry? We come across this word in biochemistry called as ETC. What does ETC stands for? ETC is none other but our so-called electron transport chain. I'll give you 10 seconds. Think by yourself. In electron transport chain, where will you come across T3's name? Anybody? Yeah, few are answering correctly. I'm hearing you guys. Hats off. Good. Thyroid hormone is called as uncoupler. What is the meaning of uncoupler, sir? T3 is considered to be an uncoupler. Whenever T3 is there, not much of ATP will be produced. It uncouples this ATP synthesis to heat production. That's all. Very important MCQ. Uncoupler in electron transport chain means it will not lead to formation of ATP. All the gradient now will be liberated as heat. Thyroid hormone increases body heat production. This important action is called as thermogenic action. What is the meaning of thermogenic action? It increases body heat production. That most important stimuli when you require thyroid hormone is obviously, think by yourself, cold environment. Always remember. During exposure to cold environment, body produces more of thyroid hormones. You answer now. Why during cold you require T3 hormone? Because it is uncoupler. It increases body heat production to combat that cold. That's all. This increase in heat production is called thermogenic action, physiological. Kindly make a note. The same thermogenic action can become pathological. The same thermogenic action can become pathological. If you understand this concept, lot of conflicts will be resolved in you. Thyroid hormone is known for thermogenic action. Suppose by any chance you will have very high levels of thyroid hormone. Where will you see? You classically call in pathology this group of individuals are hyperthyroid. Because of very high levels of T3, they are going to have pathological increase in body heat production. That is why hyperthyroid individuals are always said to be having what important intolerance? Heat intolerance. In my experience, I have come across a lot of aspirants. Heat intolerance, hypothyroidism or hyperthyroidism, hypo or hyper, no need to memorize. Thyroid hormone increases heat production, that's why hyperthyroid always become heat intolerant. On the other hand, low levels of T3, pathological low levels, we call this important state as none other but a hypothyroid state. They will obviously going to have less heat production. By any chance, If a hypothyroid individual encounters cold environment, they will have less heat production. Now you answer me. Obviously, they are now going to become intolerant to cold. That's all. Hyperthyroidism, heat intolerance. Hypothyroidism, cold intolerance, physiology, because of this thermogenic action of thyroid hormones. That's all, simple. Two functions over. What are the two functions? Basal metabolic rate, uncouplers, thermogenic action. From this important concepts, kindly make a note that third important function of my T3 hormone, very important function during development, developmental role, embryological functions. Thyroid hormone is always known for two important B growths. What are they? The first growth is bone growth. During development requires thyroid hormone. The second B, even more important, is brain growth and development, requires thyroid hormone. This aspect is very important. Brain growth means what? Under the influence of thyroid hormone, in brain there is increase in myelination throughout the central nervous system. Very important MC. Thyroid hormone increases myelination, fastens nerve conduction throughout the central nervous system. Normal physiological roles. How to remember it clinically? Always remember, whenever you come across any infants or kids suffering from congenital hypothyroidism, both these functions will be invariably affected. You are definitely going to see in them is the first important thing, stunted growth. Now we can clearly relate. Bone growth will not be normal. Congenital hypothyroidism, stunted growth. What about this normal finding turning pathological here? Brain growth will be delayed. That's why they are always more prone for MR. That is why it has got huge public health significance. It's a correctable cause for mental retardation, right? What does MR stands for? MR is none other but mental retardation. From pathology to physiology. Developmental role responsible for bone growth and brain growth. Third function over. What about that fourth important function of thyroid hormone, sir? Kindly make a note. This fourth function is totally concerned with metabolism. Very important for physiology and biochemistry. Metabolism means only three important macromolecules we are interested. The first metabolism is carbohydrate metabolism. The second metabolism is lipid metabolism. The third metabolism is protein metabolism. What is the action of thyroid hormones on metabolism? Only one keyword. None of you listening this video should never forget for your life. Thyroid hormone is considered to be the major catabolic hormone of human body. What is the meaning of catabolic? It destroys everything. It never stores. That's all. If you destroy the storage form of carbohydrates, automatically there is going to be increase in blood glucose. Thyroid hormone increases blood glucose. If you destroy this lipid storage, what we call this important aspect as, this aspect is lipolysis. Destructing lipid storage forms. If you destroy proteins, what we call this important aspect as, this aspect is called as proteolysis. That's all. It destroys everything. It causes increase in blood glucose, it causes lipolysis, it causes proteolysis. No need to memorize concept. It is universally catabolic. In the same token, kindly make a note, it also favors metabolism of cholesterol. Kindly make a note. Thyroid hormone always favors cholesterol metabolism. When there is normal levels of T3, always remember T3 hormone decreases blood cholesterol level by favoring its metabolism. Kindly make a note. Cholesterol metabolism is favored by T3 hormone. That is why normal levels of T3 hormone are always required to lower cholesterol levels. A recent NEET PG MCQ on this function, kindly make a note, T3 hormone decreases blood cholesterol levels. When you will have pathological low levels of T3 hormone, which group of individuals are they? This group of individuals are our hypothyroids. Obviously, they are going to have increase in blood cholesterol levels. Hypothyroidism is always characterized by, never forget for your life, hypercholesterolemia. Very important MCQ. Hypothyroidism is characterized by hypercholesterolemia. It is not just a simple point to write, understand deeply. This cholesterol depositing in blood vessels ultimately is going to cause one important serious disorder that can cause death: atherosclerosis and other heart diseases. Hypothyroid patients are more prone for atherosclerosis for this reason. Hypothyroid, hypercholesterolemia, atherosclerosis. Simple logic. Thyroid hormone causes catabolism. It destroys everything. It decreases blood cholesterol levels, metabolic functions. Only one last aspect of thyroid hormone functions, the fifth in our discussion. The last function of our thyroid hormone is exclusively seen at the level of human heart. What is the function of thyroid hormones on human heart? It is the only organ thyroid hormone does not have any direct action. It is totally indirect. Thyroid hormone cannot function anything in human heart. It is totally indirect. What's the meaning, sir? Under the influence of thyroid hormone, kindly make a note, one hormone level action becomes more pronounced. Thyroid hormone is going to increase the activity of norepinephrine. Understand why it is called as indirect. Every action is now due to only norepinephrine, not thyroid hormone. Thyroid hormone simply increases norepinephrine in human heart. If they ask you what is the action of heart rate by norepinephrine, it increases heart. That's all. Thyroid hormone in heart increases heart rate by increasing norepinephrine level. One more important thing, the same norepinephrine increases myocardial contractility. Kindly make a note, both these two important functions in heart are indirect. Why, sir? They are not due to thyroid hormone, they are due to norepinephrine. If you remember this as physiology, you will definitely forget. That's why, to have the same concept lifelong, kindly make a note, you must answer this MCQ. Both this heart rate, increase in myocardial contractility by norepinephrine is which receptor action? This receptor is beta receptor action of norepinephrine. It is not alpha action, it is beta receptor action in human heart. Increase in heart rate, increase in myocardial contractility. Kindly make a note, at times thyroid patients may go for one medical emergency. That state is called as thyroid storm. Kindly make a note, thyroid storm is characterized by very high levels of T3 hormone. For the treatment of thyroid storm, we always use one important drug, relate that with beta receptor. Now, if the actions in heart becomes elevated, it will be very pathological to the patient. That's why we always use beta blocker during thyroid storm. The name of that important drug we use is none other but our so-called propranolol to block these actions of norepinephrine in thyroid storm. The basis is, in human heart it is totally indirect. Thyroid hormone simply increases norepinephrine levels. It is all this norepinephrine action which is going to manifest. Increase in heart rate, increase in myocardial contractility. The basis for propranolol use in thyroid storm is this. It's a beta blocker. Let's discuss some important MCQs asked from thyroid gland. The first MCQ, thyroid hormones in the blood is transported by, what are the binding proteins? I told you, you require albumin, you require globulin. That globulin is thyroid binding globulin. You also require something called as prealbumin. The other name for prealbumin is our so-called, what I told you, trans-thyretin. That's all. Options A, B, C are correct. Transferrin is the transport form for iron. Ceruloplasmin is the transport form for copper. Simple. Major thyroxine binding protein. As I told you, it is going to be a globulin. What is that globulin? Thyroid binding globulin, responsible for 70% of hormone transport. Next major is albumin 20%. The least important 10% is prealbumin or transthyretin. Regarding thyroid hormones, all are true except T3 is more avidly bind to nuclear receptor, true. T4 has got the maximum plasma concentration, true. What I told you, the less active form is more in circulation. T3 is more active than T4, true statement. T4 has a shorter half-life than T3, false statement. T4 always have longer T-half when compared to T3. T4 has got longer T-half. The answer false statement is option D. Iodine uptake is seen in the following organs. Which all organs can take up iodine? Thyroid gland can take up, salivary gland can take up, mammary gland can take up. Other than that, one other important name what I told you, placenta. How can they take up iodine? Because they have one important transport protein, sodium iodide symporter. Very important MCQ. In these locations, thyroid gland, salivary gland, that is my parotid gland, mammary gland and placenta. See, the same question. It was recently asked in AIMS exam. Sodium iodide symporter is not present in. It is present in placenta, present in parotid, present in thyroid, but not present in pituitary. Obviously, the answer should be option A. Thyroxine injected to rat produces all except. You must expect thyroid hormone is catabolic, increase in lipolysis, increase in oxygen consumption, increase in myocardial contractility. It should not be decrease in BMR, it should be increase in BMR. So the false statements are A and C here. This action increase in myocardial contractility, what I told you, is not direct, it is due to norepinephrine. That's why we call indirect action. All are actions of T3 except increase heart rate, increase stroke volume, decreases protein breakdown. The best answer, it should not be decrease in protein breakdown, it increases protein breakdown. The best thing you must remember is thyroid hormone is called as major catabolic hormone of human body. In thyroid follicles, for how long the hormones are stored? Not days, not weeks, it is months. What I told you, it is 2 to 3 months. Very important MCQ. Hyperthyroid state is characterized by which one? Hyperthyroid, what I told you, it is universally catabolic. The best answer is always lipolysis. It does not increase protein synthesis, it is protein catabolic. Never forget this. The best answer for this is lipolysis. Hyperthyroid state is characterized by not increased cholesterol, decreased cholesterol. Only hypothyroid state is characterized by increase in blood cholesterol, which can progress to atherosclerosis in hypothyroidism.